Want to take a moment to introduce myself. I'm Ruth Rashid Kalinicki. I'm a program manager or program officer at the Community Foundation for Southeast Michigan, and it will be my distinct privilege to work with you in the months and years to come as we roll out and work together on Healthy Food Connect. Moving from the state and regional level view that Kate and Colleen and Megan just captured, we're now going to focus in even more tightly. Coming up next, we're going to invite some local folks to talk about the great work that they're doing with youth, with seniors, and in food access right here locally. Just to give you an idea of what these short talks are about, we're shooting for 5 to 7 minutes for each presenter. I will be keeping a tight time on that. And there's 3 distinct goals really for these talks. The first goal is to spotlight some emphasis on the sum of those great practices, the great work that's already happening in our region. These are some of the things that are happening in our own backyards that are local efforts that start chipping away at those gnarly, nasty, systemic problems that Kate just called our attention to. The second goal of these talks is to help motivate connections. The third goal of these talks is to generate ideas and to foster creativity and innovation. So our first set of presenters are Dr. Gwendolyn Gaddy-Dansby, who is Medical Director of PACE, which is the Program for All-Inclusive Care for the Elderly in Southeast Michigan. Nikki Milgram is the Director of Sustainable Foods, of the Healthy Communities Program at the Ecology Center. And Willie Spivey is a farmer and the Plum Street Market Coordinator with Keep Growing Detroit. So, Dr. Dansby, I invite you to kick us off.
Thank you. I'm really happy to be here. And I feel like I'm sort of the exception because I'm actually not specifically talking about food, but I am talking about an integrated care model, which is PACE, that I think has a role in being a partner and also being a place where services can be provided for what I consider to be one of the most vulnerable populations. As a clinician and geriatrician, I care for a frail elderly population. And one of the things I think that medicine and technology have done is they've actually had the ability to expand life expectancy. And many of you probably know over the last 100 years, life expectancy has almost doubled. So from the mid-40s, we're now up to the mid-80s, depending on which population we're talking about. So the ability to expand life is a wonderful thing in terms of reducing a gap. But what we have found that increasing days of life do not necessarily equate with increasing quality of life. And so one of our challenges is looking at ways and opportunities that as long as we're going to live longer, and I can tell you that that's the direction the population is going in, especially with the baby boomers, we also need to look at how we can do that better. What I'd like to talk about is what I consider to be one of the models of care that can bring all of the pieces together and help improve quality of life, especially for a frail elderly population. It's an integrated model of care, and that's probably a term that we're hearing a lot about now, especially with the Affordable Care Act and the number of folks who now have insurance and looking at how do we actually provide care to this population without going bankrupt. So an integrated care model has to do with being able to provide the quality of care for that specific population that allows you to reduce fragmentation and increase coordination of care, and therefore provide the services that are needed, when they're needed, where they're needed, appropriate for that particular population. When we look at the elderly, one of the concerns always is what is important to an elderly population. And because this is what I've been doing for 30 years, they tell me what's important to them. The first thing is they want to have good health care. Now, I recently read a quote that said, when I was young, I wanted people who were smart and skilled and talented. But now that I'm old, I also want people who are kind. As a physician, I feel that we should be able to give them skilled, appropriate, talented care, but we need to do that in a kind manner. What else do the elderly want? They are interested in having their families around them as much as they can. They want to live in the community. They don't want to go to a nursing home. Nursing homes are not necessarily bad places, but when you ask them where they want to spend those final days, they want to do it in their home. They want safe and comfortable housing. They want to feel like they can get out and walk to a store if there happens to be a store or someplace where they can get fresh fruits and vegetables. That's important to them. Transportation is important to them. And of course, having good food is important to them because for most of us, as was recently said, who doesn't like to have a good meal in the company of people that they want to be around? So those are the types of things that are important to them. They also want to have a sense of socialization or community. It's not true that as people get older that they become hermits. It's not true that they want to be isolated. They indeed want to socialize and be a part of that community, and they want to know that they're not having to confront ageism, that because you're older, that's not important. Well, you can expect that because you're old. You can expect your memory to be reduced because you're old. They don't want to have to experience those. So nutritional needs in this population continue to be extremely important, and I think I'm probably speaking to the choir because you probably know this. When we look at some of the statistics, for people who still live in the community, there can be issues with malnutrition, and malnutrition can be underweight or undernutrition and overweight, can be upwards to 15%, and when that same population is now in a nursing home, issues with malnutrition can be as high as 37%. So what does all this mean? I wanted to talk a little bit about one of those integrated models of care because I think it represents a best practice, but I also think it represents an opportunity for some partnering and some networking, and that's the PACE program, Program of All-Inclusive Care for the Elderly. This program has been around in the country probably for a little over 20 years, and there are roughly 115 sites throughout the country now in 35 states. But here in Michigan, we actually have 3 programs. PACE of Southeast Michigan. And the goal of this program is to be able to provide individuals a high-level care using an interdisciplinary team and allowing them to remain in the community. That interdisciplinary team meets at one location, and we tailor what the individual needs. There's a day health program where they can come for meals and socialization, but we also provide them a meal. We provide them meals to take home if need be. And one of the partnerships that we've recently developed is with Peaches and Greens, which is a local nonprofit organization within the city, and they've been able to come to one of our locations and provide fresh fruits and vegetables that are reasonable for those who can't get out. Now, one of the things we're looking for is we're looking to expand that partnership because right now, as great as Peaches and Greens are, they can only come to one location. So we're looking for opportunities to expand that for the 3 locations. So as I look forward to what we can do for a senior population, how we can partner, what we have to offer, I look at an integrated model of care. I look at looking at all of the determinants that affect health and well-being, and food happens to be one of them, and irrespective of age or gender or socioeconomic status or zip code, which sometimes is more important in determining outcomes than genetic code, I think that this integrated model of care and the ability to be able to provide a cohesive model of care for this aging population is extremely important, and that's what we do. Thank you for your time.